Hi there. Thank you so much for taking the time to quickly review this case study where a parent is bringing a child to your office because there is something wrong with their eyes. So this is a 12-week-old infant that was delivered vaginally with uncomplicated pregnancy at 40 weeks. This is the first checkup after birth because the mother is concerned that there's something wrong with the baby's eyes. Maria tells you that the baby's left eye looks milky and he does not appear to blink or have tears when he cries. She tells you that her father told her that he had eye surgery as an infant but could not remember why. Maria confirms that the baby had all of his vaccinations at birth. He did not have his 4-week follow-up. On physical exam, the baby has cloudiness of the left lens, which obscures the reflex, and the blink reflex is intact and there is no purulent discharge noted. So before we can work with the eye or make a diagnosis with the eye, it's very important to know the landmarks of the eye and what the functions are. So the pupil is the black area that allows light to enter the eye, while the iris is the colored part of the eye that controls the amount of light that enters the eye and reflects on the retina. The lens is the focus light on the retina, so it controls blurry vision or what you are able to see. Ciliary muscles controls accommodation, that is the pupil gets bigger and smaller, and and also where you see something close versus further away. The cornea covers the iris and the pupil only. It sits over the lens and it covers the iris and the pupil, and this focuses light. The conjunctiva is the white part of the eye, and it covers the entire eye and produces mucus to lubricate the eye. So this is a see-through fleece that covers the entire eye. The sclera is the white eyeball itself, and thus provides structure to the eye and can absorb pressure. And then finally you have the retina, photoreceptors and glial cells that capture photon images to relay them to the brain via the optic disc and the optic nerve. So the main part of your eye develops during the first trimester, and as early as 27 weeks the fetus can blink the eyelids and also open their eyes. So eyesight will continue to develop through the pregnancy and then after birth. And here are some milestones for the first 6 months that you can look at. At birth, they usually see 8 to 12 inches distances, and they may be able to recognize mom's face. I don't know if you guys have had, or those of you that have babies know that the first month they're just staring. And that's a good thing. That's better than a colicky baby. After 1 month, they can hold a gaze. 2 months, they track objects, see 18 inches away. So it's a good thing to test when they come in for their wild child. 3 months, start to see red, blue, yellow, and reach for things they will see. At 4 months, they develop depth perception. 5 months, they can see up to 15 feet. And 6 months, they can see up to 30 feet of distance. Righto. Let's look at some common pediatric eye problems for a newborn or children so that we can figure out what's going on with our little fella. So amblyopia or lazy eye is the eye usually, the affected eye usually didn't develop normal vision and visual acuity versus the other eye, and sometimes that may also result in strabism. So usually seen there's a poorly developed vision in one eye, results when there is no treatment for eye problems like refractory errors, droopy eyelids, strabism, or cataracts. They may include, or treatment may include eye patches or atropine drops. Then strabism, which is eyes are misaligned, one look forward and the other one looks to the left or up or down. This is very common, seen in about 4 out of 100 children. It requires immediate referral to ophthalmologist, and treatment is usually corrective lenses, eye patches, and exercises to strengthen the muscle. Conjunctivitis or pink eye can be bacterial or viral, and it's usually when the white, that sclera that covers the white of the eyes, is infected by a bacterial or viral. Bacterial will usually require eye drops like gentamicin and ofloxacin or ofloxacin. And then viral is just symptom control. Either way, the kid needs to be kept at home from school, and there has to be good hand washing frequently. Then chalazions and styes. So chalazions is a little bump or a lump on the eyelid itself, and it's usually painless, can be red, but usually not red. And it is when the oil gland in the eyelid becomes clogged. The key thing here is that it is painless and not caused by infections, and the treatment is warm compresses. Styes, on the other hand, are also on the eyelid where the eye lash comes out, and these are red sore lumps that is very painful. Can be an infected follicle and is caused by a bacterial infection. Treatment includes warm compression, and gentamicin ointment may be indicated. Period. Now, particularly look at our teenagers that nowadays go for the extended eyelashes. They can easily develop a stye, but don't confuse the stye with a folliculitis itself, fomites, or even bacterial infection of the eye. Then a blocked tear duct, exactly what it says it is, usually in newborns, and seen at about 2 out of 10 airborns. Treatments is just massaging the tear duct. If that doesn't help, then you will refer them to an ophthalmologist. Let's go back to our little fellow that we see. So what do we know? We know that he's 12-week full-term baby. He was Hispanic, and he had an uncomplicated vaginal delivery. So the fact that he's full-term makes it less likely that he will have any developmental problems with his eyes, because as we saw, 27 weeks is when they first can blink their eyes and then and open their eyes, and then the rest of the eye, the rods, the cones, developed through the rest of the pregnancy. So less likely that it is a congenital problem. He is Hispanic, so you have to ask yourself, are there very common Hispanic eye conditions? Now, it's inconceivable that he would have a diabetic problem, because just a newborn, 12 weeks old, so that is not it. So this we have to go and look up then. And then he had an uncomplicated vaginal delivery. Sometimes children may develop bacterial or viral infections when at birth, if the mother is immune compromised or engaged in a high-risk activity that may cause bacterial or viral infections. Unlikely here. So then the mother was concerned about the cloudy eyes and no tears. So no tears is actually normal for little newborns, because they just don't have tears the first maybe week, even longer for some of them. So that is not uncommon. And a cloudy eye, however, is a problem. So most of our children do get screened at birth, but it may be that it was not seen at the time of screening, or this child may have been a child that was not in the healthcare system, and that's why it was not picked up. The family doesn't have any eye disease there, and then your exam shows a cloudy eye that obscures the red reflex, and the blink reflex is intact. So the question we have then is, what are common causes and conditions that can cause a cloudy eye and an abnormal reflex, and what is your differential diagnosis? So let's start by looking at what a cloudy eye looks like. The top picture is normal. The second picture shows an absent red reflex in the left eye. And then the bottom picture shows a red reflex is normal, but it's white. So you have to see your provider in all those cases. Underlying conditions that can cause cloudy eyes and abnormal reflex are cataracts that clouds the lens. Cataracts is not uncommon, and we'll talk a little bit about it on the next page here. Infantile glaucoma, it may be causing the affected eye to be larger, and the cornea may have hourglass appearance. Retinal abnormalities, including tumors or chorioretinal colobolomath, and then amblyopia. Corneal infections, we talked about bacterial infections and herpes infections. Forceps used during birth causes traumatic opacification secondary to the pressure. These children are usually at risk for astigmatism and amblyopia. And Peters anomaly, where there's just no reason for it, it's just congenital, but they are at risk for glaucoma and cataracts. So looking at all these options, which is your most likely diagnosis? So the diagnosis is cataracts. So as you can see in the picture, 50% of cataracts are congenital. Chromosomal abnormalities like chromosome 13, 18, 21, and Turner syndrome, very common. High prevalence in Hispanics and American Indian families, so it can be a congenital condition. Inherited. Secondary cataracts can be a result of chronic inflammation or secondary to steroids use like uveitis because they are using, or they have a diagnosis of juvenile idiopathic arthritis and takes prednisone high doses for that. Children with intraocular tumors develop cataracts, usually because of the radiation treatment. Chronic retinal detachment, usually sports injuries or severe motor vehicle injuries or falls can cause that. Maternal infections, we already spoke about that, most commonly from birth, from the birth canal, toxoplasmosis, syphilis, zoster, CMV, and rubella is common. Then maternal metabolic conditions like diabetes and hypoparathyroidism. This causes hypoglycemia and hypocalcemia. And during pregnancy, that affects the development of the lens, and they can have a cataract. Children with metabolic disorders like galactosemia, homocystinuria, Fabry's, and Wilson syndrome may also have cataracts, and then of course nutrient insufficiencies like vitamin C and E. So exam findings will be the pupil opening, supposed to be back, appears to be white, or we call that leukocoria. The red reflex may appear white. Look for an infant that lacks response to a smile or a facial expression, or an inability to reach and grasp a nearby object. In older children, they may report blur vision. Treatment for cataracts. So treatment will focus on repairing the eye-brain connection. So a referral to a pediatric ophthalmologist is very important. As early as 3 months, they can have the total lens removal and the placement of intraocular lens or wearing contact lenses if they are older, and then of course eyeglasses also for older children. Recognizing and treating cataracts is very, very important because 80% of our learning, cognition, and social abilities are directly linked to what we can see. And so for a child, it is far more important that we pay attention to this and pick it up early, because it may affect their learning, behavior, and they may have difficulty integrating socially and in school. So if they are school age, or preschool, we consult the occupational therapist, social worker, and the psychologist. And then it's very important to bring this to the attention of the caretakers as well as the school, so that effort can be made to ensure that learning is accommodated around their needs, so that they can participate in all learning experiences. Then your toolbox, on the left, I just have baby vision development. I kind of like to give this to my parents, or I just talk to them on ways to stimulate their development of the eye. On the right, I have vision screening recommendations. Kind of make yourself a toolbox. Mine is alphabetic, so eyes. I would put that under my eye section, so that if I wonder when they should have their next eye screening and what I should look for and when I should refer, this is a real easy way to summarize it. And then familiarize yourself with the signs of vision problems in toddlers particularly, and in school-age children. It's not, it's difficult with a 2-year-old because they can't read yet, but they may have a different way of looking at a book. They may hate reading because they cannot see. They may have difficulty with reading when they are in kindergarten or preschool. And then they may have runny eyes, headaches, all kinds of things. Just be aware of that so that you can check their vision appropriately. Finally, I like this quote. It says, "The vision we offer our children shape their futures." And this is said by Carl Sagan. Thank you so much for your time, and I hope that you found this helpful.